Today is the ribbon cutting for a new state-of-the-art facility in the Bronx. It's 21 inpatient beds for mental health. Includes dining rooms, comfort rooms, classrooms, and it will care for children as young as 5 years old and children as old as 17 years old. There's a dire need for mental health care in the borough, in the state, and in the country. And today, by opening this facility, we are doubling inpatient capacity for mental health beds in the Bronx. And so I welcome you to look in and get a glimpse of the future of healthcare and the transformation of mental health here in the Bronx. Today, I'm proud that we have, as a leader, a governor who not only made a promise, but followed through, and we're now doubling the mental health beds in the Bronx. Please welcome the governor of New York, Kathy Hochul.
Thank you. It is so great to be back here, and I'm proud we could keep that commitment, because it's a commitment that's not just words. It's a commitment to people and our belief that everyone deserves high-quality health care, particularly in a space known as mental health, because it's been overlooked for so many decades. Investments should have been made that were not. And as a result, we have more people struggling who could have had interventions as children and freed them from a lifetime of needing additional care, but that day starts now. And Dr. Oswald, leadership really matters. And your voice and your leadership of this extraordinary organization, Montefiore Einstein, is a place where compassion just oozes out of every individual associated with it. I can see it, I can feel it. When I walk into rooms, people care deeply about others. And I want to thank you for leading this organization. Now when you walk in there, a young person who feels like they've been abandoned, forgotten, that they don't have worth, they walk in here and it is beautiful. It is calming. I even felt calm walking through there. And you did an incredible job creating an environment of healing, nurturing, and love.
Picture someone you love deeply. Maybe it's your child, a sibling, a niece, or a nephew. See their face clearly in your mind. Imagine they're struggling, feeling scared and vulnerable, and they need help. You brought them to a psychiatric unit because you know it's the best way to keep them safe. You're standing at the entrance. The doors are locked. You see your loved one in a hospital gown looking back at you as they're led inside. They're confused, maybe even angry or afraid. You can't go with them. You're not invited. You can only watch as those doors close. Feel what's in your heart right now. The worry, the guilt, the hope that the people inside will care for them as you would. What do you want the staff to know about your loved one? How do you want them to treat them? After 22 years and many years working with the hospitals in the psychiatric mental health facilities, I thought that I knew everything there was to know. I thought I felt it all, knew what we needed to change, and understood what was going on. But boy, was I wrong. Up there on the screen are the loves of my life, Noah and Chloe. And this little Nemo costume later is Noah when he was pretty young. Like any parent, I wanted to protect him and keep him safe and happy. But years later, I found myself standing outside of a locked psychiatric unit, watching him through those doors. I thought, he must be so scared. He's at his weakest point. I felt so helpless. That fear that he wouldn't be safe, that he'd feel abandoned, it was quite overwhelming. I wondered if I was failing him by muting him there. And I had seen the inside of those spaces, so I was scared. Every family who leaves their child in a mental health facility feels some version of that fear.
Our mission is to provide compassionate, innovative community focused care for children and adolescents with mental health problems in the Bronx and in the region at one of the most challenging and formative times in their lives.
When we started the Montefiore Einstein Center for Children's Mental Health Project, we really started by asking the question, how do we want patients and families to feel? We've really strived to include patient and family input from the beginning. I know a lot of places end up having patient and family advisory councils after things have launched. What we've really tried to do is bring that input in before. So things that we have a little bit more flexibility around. As an example, what visiting hours are really convenient? What food options should we really have available for patients? What should the snacks be? How often should patients and families be communicating with providers? Is there a way we can do that better? And so those are things that, as regulated as psychiatry and behavioral health is, we know that there are areas where we have flexibility, and we've really taken the time with our staff, our amazing staff, to get that input from our patients and families.
At the Montefiore Einstein Center for Children's Mental Health, we hope that when children and families come through the doors, they see the kind of respect and hope and optimism that we hold for them.